Hello guys, welcome back to our another podcast video where in today's video we have our senior doctor, senior consultant orthopedics, Dr. 𝐒𝐻𝐫𝐢𝐻𝐵 Maheshwari. Hello sir. So welcome to our podcast. I just want you to briefly introduce yourself and just tell us about your journey in orthopedics.
So I'm 66 years old. I am born and brought up in Delhi. I did my college, that means MBBS from AIIMS New Delhi. Then I worked there after specializing in orthopedics for almost 12 years. And for now, last 25 years, I'm in private practice. I have worked in different hospitals in Delhi and presently I'm working at Sitaram Bharti Hospital. And I specialize in knee and shoulder surgery.
How was your journey in AIIMS? Like what was the duration? How was your time period? Like how did AIIMS treated you?
Well, AIIMS was, getting into AIIMS was like magic because those days 35,000 children used to apply and only 35 used to get admission.
Okay.
So nobody knew who will get, so it was like lottery, I would say, to get into AIIMS. I could not believe myself that I've got admitted into AIIMS. But AIIMS as a medical institution is a class apart in India and everybody kind of knows it because there's a lot of academic ethos. So everything that is done there is based on science. So right in the very beginning, as students, as children, young, students of medicine, we were taught to think logically. So you cannot say this is so. You have to say why this is so. So that way of thinking logically, that whatever you say in this field of medicine, you have to be very sure about what you're talking, and you can't be doing tukebaji.
So sir, what has motivated you to become orthopedician and how do you think has this department evolved?
Oh, that's a very interesting story. And every medical student, when he's in final year MBBS, he's all the time thinking, what will I do in future? They are thinking X, Y, Z.
Yes.
And same was with me, but then in hindsight, I realized why I became a surgeon. So, in first year in MBBS, we have two subjects. One is anatomy and one is physiology. Anatomy means you go to the dissection hall, you open the body and you see what is there. And in our book it is written, if you go down, this nerve will branch into 2. It will branch into 2. Then you open further, it will branch into 4. You'll find it will branch into 4. Which means whatever is written in the book, whatever we find in the body. On the other hand, physiology was a very theoretical subject. So for example, diabetes. Why diabetes is happening? Because the insulin is not there. Nobody has seen insulin. Nobody has seen how glucose is absorbed. All those are theories.
Yeah.
So those are chemical sciences where everything is working on theory. So as a young medical student, I was more attracted to something that I can see with my eyes. And as a child also, I was good at drawing. I was good at, clay playing and those things, So right in the first year, I knew it is anatomy, which is this I've thought in retrospect. So I tell medical students that if you like anatomy more than physiology in first year, your mindset is probably wired for surgical field. That's the basic thing. Then when you come, I came in final year and I got into, what surgical field? There's so many surgical fields. So being from AIIMS, the most attractive is always cardiothoracic surgery. We want to become a heart surgeon. That has its own glamour. So I went to the heart surgery department and I realized they're working like day, night, and patients die. And I realized this is a very sensitive field where you have to give 200% and still patient can die.
Yeah.
Then I went to neurosurgery, another very glamorous department, brain surgery and all that. So I went there and there I realized that patients don't die, but they don't even live because half of them are in coma or they're paralyzed, so they can't walk. It's a very, very morbid branch.
Yes.
So again, didn't appeal me. Very morbid branch. Then I went to another two surgical branches, ENT and ophthalmology. They are also surgical branches.
Yeah.
There's no one drop of blood coming out in this surgery. ENT in a small hole you are operating, hardly any bleeding. So that was not like surgery, it was more or less medicine, I would say.
Yes.
So then finally I came to orthopedics and I said, this is a good branch because you behave like a surgeon. And the most important part was that it was a very dramatic branch. In the sense, somebody will come to you with a broken hand and he's coming like this, crying loudly, and he can never imagine this hand will work tomorrow. He will think maybe my hand will be cut now. They come at the time of accident, you feel you're dead, you can't even move your leg.
Yes.
Fracture has happened. And within 2-3 days, then you fix the fracture and then he's moving his hand. So very, very gratifying. Though technically not very demanding, like heart surgery or neurosurgery, but it's a magic branch in the sense patient comes with 10 fractures in the body, he's sitting in the chair. Within 2-3 months he's walking. So patient with 10-15 fractures who could never even imagine that they will be alive or all their limbs will be normal, good to go. And it's very dramatic that way. The results are very dramatic. Efforts are not so much.
Okay.
So I would say it's a good branch that way. So I chose orthopedics then.
Okay. So how do you think that this department has evolved?
Yeah, so when I joined orthopedics, it was a rather primitive branch. And why I joined orthopedics was, again, I was very fond of clay modeling and things. And those days, orthopedics was all plastering. No plaster of Paris. So it was something similar to what I was doing as a child. But over the years, the whole thing has changed in orthopedics. I think it is the best and the most developed branch now because we have now fixation for fractures. If you have a fracture earlier, we used to treat them in a plaster for 3 months, then physiotherapy for 3 months. Today what we do, we take them to the OT, put a rod inside, you go home tomorrow morning, after a week you're working. So all that has changed, the style of technology has changed. Now we can replace joints. So I see patients coming on a wheelchair, has not walked for almost 2 years, and then you replace their joint, within 3 months they come to you walking. So that technology has made a very, very big difference in orthopedics as a very productive branch, I would say. You do something, you see the result.
Do you know any technology or any advancement which you can discuss about?
Yeah, so every field is advancing. In orthopedics, I think 2 major advances that has happened in last 20 years. One is keyhole surgery. So a lot of operations which we used to do by open surgery earlier have become keyhole. That means 2-3 small punctures. You introduce a camera in the shoulder, in the knee. Like everybody knows laparoscopic surgery, but even the joints now we operate through telescope. So we put it's like a telescope, like a pencil. You make a puncture, introduce patient is under anesthesia. There's a camera here, and you can see everything on the TV monitor. And then you make another puncture, introduce another fine instrument, and start working. So without opening, you are actually looking inside the joint, you are moving the joint, what you are doing. So
it's somewhere like laparoscopic.
So a lot of repairs, a lot of reconstructive surgery where we can repair the joint have become now arthroscopic. They're not open surgery. On the other hand, the other branch is joint replacement, where you cannot repair something and you have to replace.
So I wanted to ask, what is the chances of mortality in this branch? There must be very severe cases also. They can be cured or maybe...
I think unless the case is very serious to start with, the mortality is pretty low.
So what's the most serious case?
For example, somebody comes with multiple fractures and then because of the fractures he develops bed sore, or there's a thing called fat embolism. A lot of blood clots move from the limb which are not moving, and they move to the brain or to the heart and they die. So except those rare cases where because of these complications of a patient who is bedridden. So when a patient is bedridden patient is subjected to some complications. You're in alloplane sitting for 12 hours, 13 hours. They tell you keep moving your limbs because otherwise you develop clot in the leg. Similarly, if a patient is bedridden because he has severe injuries, clots form in the leg, in the hand, and they go to the heart and to the brain. And that can be a reason for death.
I just want you to ask that any of your most memorable case, any of your most memorable patient case.
Well, as a doctor, I think the most memorable orthopedics is not a life and death branch. Not many patients are dying, so we are not called upon saving a life. We are more quality of life doctors. Neurosurgery, they save life. We don't save life. आप टेढ़े मेढ़े चल रहे हो, आप चल नहीं पा रहे हो, आप जिंदा हो लेकिन जिंदा नहीं हो. उनको हम बनाते हैं जिंदा हो तो ठीक से चल लो. If I can recall, as a doctor, I have saved 3 lives in my lifetime, 40 years, where I think I was the savior. Like, I can't say this, but I was the God. So I was at the right moment at the right time, and if I wasn't there, that patient would have died. Once I was just going out and I was going home, something happened to me. एक बार देख लेते हैं उसको. And I almost sat in my car, and somebody told me एक बार उसको देख लो. And I went, and the patient was almost dead, blue. And it was like 8:30 in the evening. It was in AIIMS, and 8:30 in the evening. Nobody would have seen that patient for the next half an hour. It's just that I reached there and I put everything in action, and I reacted appropriately, and the patient got saved. If I would have gone home that day, I'm sure next morning they would have told me the patient died in the night. So some such incidents happen, but those are long stories.
Yeah.
If you do not realize what profession you're in and what that profession is giving you, it is your fault.
Yes.
So no other profession can give you what you get as a doctor. It cannot give you.
Like you are already keen in this profession and everything. From childhood only you had this thing in your mind that I want to become a doctor or something.
No.
Or you wanted to go in something else.
No. So I'm the first graduate in my family. So both my parents were not graduate, they were business people.
Okay.
Like we are from Baniya community, so business. Sab dukandar, sab shop pe baithne wale. If I can think, a lot of people have asked me this question, why did you become a doctor from a family like that, where there is no environment of studies? कोई पढ़ने लिखने में interested ही नहीं है, वहाँ सब खेलने में और business में interested है. So what made you think so? I think I was very poor as a sports person. I used to lose in every game.
Okay.
So my cousins were so smart and everybody else used to outplay me and I used to lose everywhere. जाना है तो हार नहीं है तो क्या करना है, इसको नहीं करना. I started reading and I started interested, getting good marks. That gave me a motivation कि इसमें marks आते हैं. जब क्लास में जाते हो तुम फर्स्ट आते हो तो टीचर तुम्हें पैट करता है तो थोड़ा मोटिवेटेड हो जाते हो. तो उससे वो पढ़ाई शुरू हो गई.
So like have you been involved in teaching?
Yeah, I'm a very passionate teacher. In fact, I've written a book in orthopedics, which is called Essential Orthopedics, which is #1 selling book for medical students.
Wow.
So if you have any medical student in India and you ask him which book did you read during MBBS for orthopedics, it is Maheshwari.
Wow.
So it's 28 years. It is 28 years old already, and I wrote when I was in AIIMS, and this is the #1, almost 90% penetration. No other book sells as much as this sells.
So any suggestion you want to share to those aspiring orthopedicians?
These days there is a lot of restlessness amongst doctors to make it big quickly.
Okay.
The first thing is they compare with other professions. Second, they think that they have to put a lot of efforts. Medicine is a branch where you have to work from your heart and soul.
You know, there are many kind of myths that only boys choose this branch and girls, they won't excite girls.
Yeah, orthopedics is a little more man-oriented branch. Traditionally,
so why is that?
I think it is changing now, but I think it is more to do with more manual kind of work.
Okay.
It is changing now, but it is definitely more man-oriented orthopedic. In fact, most surgical branches are more man-oriented.
So also I wanted to ask that how does a individual's lifestyle in terms of any physical activity or nutrition change in this orthopedic health?
It's purely lifestyle based.
Okay.
So most of the orthopedic problems are lifestyle based. To give you a simple example, laborers who work on the road have very few orthopedic problems. Villagers have very few orthopedic problems. It's a disease of lifestyle. घर से बाहर निकले, गाड़ी में बैठे, ऑफिस गए, गाड़ी में बैठे, वापस आ गए. So no physical activity. That's why nowadays you count your steps, you make 1,000 steps because you're not walking. So people now have to go for a walk because they're not walking otherwise, and they have to count their steps. So basically, weight and regular physical activity of some kind is what is required.
Any advice you want to give to our audience to maintain a good musculoskeletal health?
I think one thing is you should have a balanced diet. Now this is a very common term, balanced diet. What is balanced diet? Balanced diet means normally in our diet, in a regular diet, in a vegetarian diet, something is deficient. In a non-veg diet, something is not deficient. So particularly a vegetarian should take something like 50 gram protein every day.
Okay.
Which is not there in usual vegetarian diets. You cannot. So you have to make an extra effort to take protein. How do you take it? Either there are something like soya bean and like protein like paneer.
Pulses.
But if you eat so much paneer, you get so much protein. So again, question of weight comes in. How much are you eating? Who will eat half a kg paneer? Nobody will eat. So then comes this question of supplements like protein supplements mixed with milk. Everybody should take about 50 gram of protein every day.
We have heard people just say that no to supplements. These are artificial supplements. You should not take. They have another side effects on your health.
No. I think those are wrong notions. Yes, if you can take in diet, but most vegetarian diet you can't. Non-veg, it's okay. I'm not saying you eat non-veg then.
Yeah.
So that's not the point.
So
but
vegetarians can eat protein supplements.
Yes,
they can include.
They should.
Okay, and some people...
And also calcium, for example, in orthopedic viewpoint, calcium deficiency, vitamin D deficiency.
Yes.
That happens because we are not exposed to sunlight now.
Yes.
Though India is a sunny country, there is so much sunlight here,
Yeah.
but the incidence of vitamin D deficiency is more here than abroad. Because abroad you are in a sun, but temperature is good. You are roaming around on the road.
Exactly.
You are even exposed. You get sunlight.
Yes.
Here, everybody, there is a lot of sun, but who wants to stand in the sun?
No one. Yeah.
So even if you are standing on the road, you will stand under a tree or under a shadow. And similarly, you will go in AC and come in AC. So where is the exposure?
Yes. So I wanted to ask, sir, that uric acid, patients, their protein is already high.
So uric acid is another big myth.
Okay.
And even doctors don't understand this.
Okay.
High uric acid does not mean you are suffering from arthritis because of uric acid.
Okay.
High uric acid is just what I call a messenger. High uric acid in the blood is a sign that you don't have a balanced lifestyle. You are eating too much, you are resting too much, you are maybe drinking too much. It has nothing to do with arthritis. And I see n number of patients, they get their uric acid done, then they take medicine for uric acid.
Yeah.
Which is absolutely wrong. There's another disease called gout.
Gout, yeah.
Where uric acid is high, but patient has very typical symptoms of gout. Only in those diseases you need treatment.
Apart from all this, I wanted to know, how are you balancing your professional and your personal life?
In life, you evolve as it comes. Again, this question has been asked by a lot of people to me. I say life just flows. If you try to turn it left and right, it will be very difficult. It just comes. So when there is a work at home, I take one day off and work. Fully committed there. When there is no work home, I am here. I don't think about home then. So every day I don't have in my mind, okay, I'll work for 5 hours and then I'll go and do this and go for golf and relax. That's my work-life balance. Personally, I don't feel the need of it. If you are enjoying your work, you don't need holidays.
Exactly. Any one multivitamin or any kind of one vitamin which anyone can have but do not get any kind of side effects or something like that, because all of us Indians are suffering from low vitamin, low B12.
So there's a new disease called supplements.
Okay.
It's a new disease.
Okay.
You eat this, you eat this, you eat this. We are made to feel as laymen that if you take this thing, you will be younger. If you take this thing, you will be healthier.
Yeah.
This is all myth. This is all making money. There is a huge multi-million market called food supplements. You know what is the difference between food supplement and medicine? They are all come in capsule.
Okay.
So when you see a capsule, you think it is medicine. Actually, it's not medicine.
Okay.
You read the label, it's called food supplement. When you get a medicine in the market, it has to pass through very stringent tests. How? If I say this medicine I've created, this is good for brain. So I give 100 people this medicine and I give 100 people similar looking medicine but with chalk powder. Then I see out of this 100, how many got better, and out of this 100, how many got better.
Yes.
Suppose out of that 40 got better, and out of this also 40 got better, then medicine is doing nothing.
Yeah.
So every medicine that comes in the market has to pass through this test. That's why they cannot come into the market unless they have done this research, they published that okay, 40, it was 80 here, it was 40 here.
Yes.
But food supplement, there is no such law. You can make anything and just put it in a capsule and sell it. Patients think it is medicine. A doctor is writing something, it is medicine, though it is not medicine. So all this supplement is a hoax, big hoax. I am 66 years old. I've never taken any medicine, no B complex, nothing. Only for last maybe 2-3 years, I'm just taking calcium, vitamin D because I know I'm not outdoors so much and all that, and with age, bones become weak. But otherwise, no supplement. I would say ladies after 55 and gents after 65 should take some calcium, vitamin D supplementation. There's so many of them.
Okay, so thank you so much for having us here and giving your time.